Welcome back. Better Health Time with Dr. Jon Lipre. Always such a pleasure to have you on.
Thank you. Thank you. Thank you for having me.
We are talking about something pretty important today. I love this because it's often overlooked. We're talking about seasonal affective disorder. What exactly is this?
Yeah, we call it SAD for short, or winter depression. People basically get pretty sad during these gloomy days, these gloomy, foggy things. Pretty common, affecting about 10% of us at one point or another.
So what are the symptoms that people should maybe be on the lookout for? Because it might be a coworker you see, it might be you. You're a little bit blue.
Oh, absolutely. The emotional symptoms: sadness, irritability, feeling hopeless, difficulty concentrating. There's physical symptoms as well. We're sleeping too much, we're overeating, especially carbohydrates. We don't really know why, but we do. And feeling listless or foggy-headed.
Yeah. That sleeping too much, it can affect us on the morning show in the middle of the day. It's just because you just don't want to sleep during. But that's the thing. If you're sleeping during the day, you got to be mindful of this. It can bring you down.
It's too easy to sleep in. Yeah.
Yeah, absolutely. So there's also, the symptoms that are fairly common. Maybe it kind of gets a little too far. We're going to get a little bit dark here. We're talking about kind of suicidal thoughts. What should people, if they're having this, if they're feeling that bad, what should they do in these cases?
Suicide is a no-go. If you're feeling suicidal, you need to talk to your counselor. You need to get to the hospital. That's pretty serious.
And they got this new hotline now, 988, right? This is the national hotline for suicidal prevention. You can also text this number, I believe.
Absolutely. I hope we have that on the screen.
Yeah. But if you're noticing a loved one that's maybe saying stuff like that, it is time to get action on that.
Absolutely.
Yeah.
And then if your symptoms are interfering with your activities of daily living, if it's interfering with work or relationships, that's also the time. See your counselor. We have treatments. They're effective.
Yes, absolutely. So what causes this? Is it up in Missouri, it's the cold weather. We're not having that up down here, but it's still, you do kind of get a little blue during December.
Yeah, the darkness, it messes with your brain chemistry.
It's time of day.
Absolutely.
Okay.
The two biggest changes: it'll decrease your serotonin, which can cause depression. It'll increase your melatonin, which will cause you to be listless and foggy-headed. Yeah. And there's a whole host of other chemical changes. We're kind of working all that out. You'll hear a lot about vitamin D. That's another big one that we're kind of looking into.
Yeah. So recommendations possibly, is there something that we can maybe do to do this just everyday life? I mean, or just be more mindful of it? What do you think? Well,
recommendations for a mild case, that experts recommend you establish a morning routine, that regular exercise has been proven to help. Get outside, obviously, that's a big one. And really talk to family and friends. Establish a lifeline. You have someone to check on you.
Yes, Dr. Lipre, always so important to get your perspective on these things. We really do appreciate that. All right, folks, we're going to go to break and we're actually going to go to Adam. Excuse me. Let's go ahead and kick it on over to him.
I-10 at Breaux Bridge right now, still showing those gray, cloudy, foggy conditions out there. We're going to be tracking some possible record temperatures this afternoon. Details coming up.